Seabeach Radio, because it always rains in paradise.
Hello, I'm Jack.
And I'm Jacob.
And we're doing Post Life. And we've got Will with us.
Hello. I am a graduate account manager in clinical nuclear medicine.
Okay. So what do you actually do? Because I don't know what that means.
Can you tell us if you could sum up what you do in 5 words?
Cell nuclear medicine equipment.
Well.
There you go. Okay, now just tell us what you do.
I work in nuclear medicine, specifically SPECT as opposed to PET imaging. So
What's the difference?
Single photon emission computed tomography.
Okay.
And then the other one is positron emission tomography.
What's the difference between those?
I couldn't actually tell you.
Are they used for different applications?
Yes.
Okay.
Yeah. PET imaging is a lot newer, and SPECT is a bit older. With PET, you get a lot more. You get higher quality functional images as opposed to the SPECT. But they definitely have their uses each. But it's definitely going more towards PET in the future.
And they use photons?
Yes.
They emit photons. Okay, right.
Well, PET stands for positron emission tomography.
Yeah, you know your stuff.
Do you know what positrons are, Jack?
Are they really optimistic electrons?
Yeah, that's basically it. I can't remember
Is it?
No, I can't remember I can't remember the physics behind it, but when matter comes into existence, it has to come in with its matter and antimatter particle. So you get an electron and a positron being created at the same time. They both go off at 90. How would you say?
That's 180 degrees.
180 degrees from each other. They both hit scanners either side, and then they can originate where that came from by the distance they've travelled, and that's how they get the location.
So it's kind of like radar with antimatter.
Yeah, that's basically it.
That's not accurate at all, is it? What
No.
I said. Okay. That's pretty cool. That sounds pretty sci-fi. And
it's all right.
You sell these for analysing what?
The main bulk of my work is a machine called Technogas.
Yeah.
So it uses sodium pertechnetate from a technetium generator, and it binds it in carbon nanoparticles. So almost like a buckyball. Yeah. But it's technetium radio labeled. So that you then inhale this, and then it shows up under the gamma camera, the functionality of your lungs.
Right.
And then this can be compared to a scan of your lungs that has been injected. So that you inject the sodium pertechnetate with a radiopharmaceutical, so it targets the lungs. And then this, you can compare the two of them. So a ventilation image of the lung and a perfusion image of the lung. And then you can tell whether they've got blood clots or not.
Oh, okay, by comparing where the air can go.
Yeah, compared to where the blood is. So if there's no blood and there is air, you've got a blood clot. Whereas if there is no ventilation and no blood, it's probably something else.
Who do you sell this to then? Do you sell it to the NHS or private?
Hospitals. So most big hospitals have a nuclear medicine department.
Okay.
But they're usually pretty small because it's quite a niche field.
Yeah.
Yeah, each big hospital will definitely have them. I think there's 120.
So for this procedure, you inject radioactive stuff into people or you make them inhale it?
Yes.
How do people react when you tell them you're going to do that to them?
I don't know. I don't have to deal with that.
I guess, yeah.
I just sell them the equipment.
Are you aware of patients rejecting it as an idea, or?
I think there is. So patient compliance definitely in nuclear medicine is a bigger thing than in other fields because I suppose there's kind of a negative connotation with radiation. But if someone tells you you've got to do that for them to know what's wrong with you, you're probably likely to do it. I mean, I would. Yeah. I know there's certain cases where they've had, so there's another drug that is done, it's called Octria-scan. So that's the imaging of neuroendocrine tumours and the metastases. Mm-hmm. This involves you have an injection, then 4 hours later you get scanned, which takes about an hour. And then you have to get scanned 24 hours later, and then again 48 hours later. And this is quite a serious cancer, neuroendocrine tumours. Mm. And people just sometimes don't turn up for the following treatments.
Wow.
The following scans, they just don't bother.
On what you said about the buckyballs containing the radioactive isotope. For those at home who don't know, buckyball is basically a molecular ball.
Buckminster fullerene. That's it, isn't it? It's pretty cool. Google image it if you don't know what it is.
It's about 60 carbon atoms all arranged in a ball, and then, like you say, it acts like a cage almost, so that I suppose the radioactive isotope doesn't penetrate cells that it's not meant to.
So I think it's a buckyball. The idea, but it's very similar to a buckyball if it's not a buckyball. But I think it's a buckyball. But yeah, it keeps the radiation and stops it.
Right. I was having a chat with Jacob before, and I thought this was a really common exercise that you did in physics. It's like a thought experiment.
Yeah.
They didn't actually give us radioactive material, probably against health and safety.
Slightly irresponsible.
You've got a piece of alpha radiation, a bit of beta radiation, and a bit of gamma radiation. And you've got to hold one in your hand, put one in your shirt pocket, and swallow one.
Yeah.
Where would you put what piece?
Well, you swallow the gamma.
Yeah, that's right.
Probably put the beta in your shirt pocket. You'd hold the alpha to keep it away, so it's just your fingers that are getting affected. I would anyway. Or no, you probably put it in your shirt. I don't know. So I'm going to go with alpha in your shirt pocket, beta in your hand, gamma swallow.
Oh, not quite. You're right with the gamma, I think.
Yeah.
You would want to hold the alpha in your hand. Oh no! Wait. No, sorry. Did you say alpha in your hand?
No, I said alpha in your shirt pocket.
Oh, I think you're right then. Yeah.
Because it's really short penetration. So if it's in your shirt pocket, it might not.
Yeah, I'm pretty sure you'd swallow the gamma because it's not highly ionizing, so it doesn't do much damage, and it will just go straight through your body, basically. So it'll go through all your living cells without doing any damage.
Are you going to give a brief description of what alpha, beta, and gamma are?
Yeah, right. So gamma radiation is like, it's gamma waves. It's like it's a wave thing.
It's a wave thing.
It's a wave thing, yeah. Whereas alpha radiation is 2 protons and 2 neutrons, which is otherwise known as
helium nuclei.
A helium nucleus, yeah. And beta radiation is pretty much electrons, isn't it, that are emitted. You would want to swallow the gamma one because it doesn't do much ionizing. It will just go straight through you. The beta emitter you want to put in your pocket because it's kind of the midway point. It's pretty ionizing, but clothing will stop it.
Just thin layer of aluminium foil, you could stop it. I remember doing those.
And the alpha is really highly ionizing, but it'll be stopped by something as little as the dead skin on your hand. So even if you hold it, it will only get as far as the dead skin on your hand before it can penetrate to living tissue. So if you're ever working and they offer you that choice,
in the world we live in where people start handing out radiation.
Yeah. Well, I was telling Jacob about it. I was like, yeah, you got to swallow one, put one in your pocket, hold one. I think he thought that we were actually given them.
I thought you had a really unsafe physics class back in secondary school.
Oh, we did, just not radioactive stuff.
Talking of that, there's some brilliant new radiopharmaceuticals or ideas for alpha emitters.
Yeah.
And gamma emitters. So there's this one where they inject these things called microspheres, and they can either be glass or carbon, I think, into your liver, and it's like super high radiation, like gigabecks of it.
I was going to say, I love the definition of super high radiation.
Gigabecks. And they inject them, and then they can't pass through the capillaries in your liver. So these like super high radiation microspheres get stuck and break down the cancer. I know gamma's really good for imaging.
Yeah, because that's the one you would want to swallow, and then you can image with it.
That makes
like
sense because the camera's called a gamma camera.
Yeah.
That's just made the connection there.
Yeah. That's it. Gamma cameras, PET and CT scanners. I think they're the ones I looked up. That were the main uses for nuclear imaging.
So nuclear imaging, yeah. So a lot of the new cameras will be SPECT CT. So it will be a low dose CT scanner, and they'll do a few slices. You don't get much radiation, and it's not as detailed as a proper CT scanner. But you can, because nuclear imaging is functionality rather than anatomical, and then you can obviously use the CT to do the image the anatomy. So then you've got a dual image rather than the traditional just nuclear image that's a bit fuzzy. The SPECT CT ones will do that, and then you'll get a glowing hotspot of what you're imaging with the nuclear medicine thing.
Okay, right.
The tracer.
Talking about names of things like CT scans and that. Yeah. Do you know what MRI used to be called?
No, carry on.
Well,
so MRI stands for magnetic resonance imaging.
It used to be referred to as nuclear magnetic resonance imaging, NMR. But they had to change it to magnetic resonance imaging because people didn't like the word nuclear. They didn't change anything about the process at all. It's completely the same. But they had to change it because people were refusing to get scans because it had the word nuclear in it. And this was in the 1970s when people were, understandably a bit worried about nuclear stuff because it was going to blow up the world. It was right in the middle of the Cold War. But the reason it's called nuclear is because I think it basically relies on rotating the nucleus of an atom. So it's not splitting atoms or anything.
It's just the resonance.
That would be dangerous if you split someone's atoms.
Yeah, it's to do with like you say, it's the alignment of the water molecules basically, because water makes up 80% of the body, so they can image nearly all tissues based on the water content and the alignment.
Yeah, I think they had the same issue with microwaves, because they also rely on rapidly rotating water molecules, because they're lopsided essentially in a magnetic sense, so you can rotate them really quickly to heat stuff up. But when all the scientists were talking about this, they were using the word nuclear because they were affecting the nucleus of the atom. Then the PR people got on it. They were like, no, people won't buy this.
We can't sell this.
Yeah.
Okay, that sort of segues into a little bit more about the safety of these things. Do you have to come up with any safety stats if you're selling these to doctors?
Yes, it's quite an important. Whenever we're selling anything, we have to tell them the effective body dose and the dose which will be administered to different body parts. So depending on the tracer and what it's targeting. So if it's a tracer that's going to the abdomen, then we'll have to state the effective dose to, say, the kidneys, the pancreas.
I imagine that's one of the leading selling factors from one radioactive isotope to another, is if one stays in the body for longer or less amount of time, then the doctor would want to expose the patient to as little radiation as they can.
Yes and no, because indium's used quite a lot because you can image for several days afterwards because of the long half-life. Yeah. But that does mean more radiation. Whereas with technetium, because it's only a 6-hour half-life, do day scans days afterwards.
Okay.
Because it's only 6 hours. And if you wanted to, you'd have to give them a lot of technetium.
Okay.
Yeah.
So you'd have to give multiple doses, which in itself would be a problem, and that'd be worse for the patient.
It'd be difficult to give multiple doses because you don't know if the uptake would be the same on different days. So you have to do it with one, really. You can do it, but it'd be difficult to compare the images.
Is it expensive to source the radioactive material?
Very.
Okay, so that's why they want less.
No, it's patient safety more than anything. Okay. If you can expose the patient to the least amount of radiation, that's better. So nuclear medicine departments are really expensive compared to other departments. So to CT scan someone's a lot cheaper than to do a lot of the nuclear medicine scans.
Yeah.
But you get the functionality rather than just like a anatomical picture.
I also assume, because of, again, from a safety point of view, if you're storing large amounts of radioactive material, you're going to want to be careful, and even that in itself would be pretty expensive, wouldn't it? Yeah, so the safety side of it, there's a lot of hoops they have to jump through. So each department will have something called a RSAC license holder. Right.
Don't know what it stands for. But they're in charge of keeping tabs, records, everything on the amount of radiation. So they can only have a certain amount of radiation going in and out of the department. So that includes all the different scans. They need the flood sources as well. So all the different tracers, the flood sources.
What's a flood source?
A flood source is it's kind of like a map. Its radioactivity is uniform, so you use it to calibrate the cameras at the beginning of each day.
So you know what the mat has, and then you can compare.
Yes,
the dosage in the
So
body.
it calibrates the camera, the crystals in the camera, and they're usually cobalt-57 because they've got a long half-life, so they can keep them for a year, 18 months, rather than having to buy one every few months, which is unfortunate for me, being a salesperson.
Being on the sales side of the medical. Yeah.
Yeah. But this patient, so the department, the safety in the department, so they have to keep track even so much as what's going out with each patient of the department. And if a patient's been referred to them that's been treated elsewhere, they have to keep tabs on that as well.
Yeah, I can imagine keeping track of where radioactive material is, even if it's inside someone, is quite an important thing to do.
Yeah, and just pouring it down the drain and everything. There's limits.
Oh,
they
God.
you have to have a specific toilet in the nuclear medicine department for the nuclear medicine patients to use, because obviously a lot of it
nuclear
is
poos.
It comes out in urine, so they have to keep tabs on that.
Well, speaking of keeping tabs on nuclear material. You were talking about cobalt-57?
Yes.
Do you work with cobalt-60 as well?
No.
Okay. In 2013, a lorry was held up in a armed robbery, and the thieves stole it. And there was a bunch of cobalt-60 on it.
That's not good.
And they drove off not knowing what it was. and I don't think they did too well. They were obviously trying to find the truck more than they would if it was, a bit of money or other supplies, but it took them a while to find it, and they were worried that it was going to be a dirty bomb and that they'd done it deliberately, but it turns out they hadn't. It was a complete mistake, and
they'd hijacked a radioactive.
That's a mistake.
It'd be hard to sell as well, wouldn't it?
Officials are worried that they may die from exposure to radioactive material. That was the closing line on this article. It doesn't actually talk about the fate of them.
I suppose that's quite an easy lorry to track down, I would imagine. If they
it's the glowing one.
Yeah.
I actually went to a reactor on last week.
Yeah?
Yeah, a nuclear reactor.
Which one? In Bristol?
No, there's not one in Bristol. I went to Poland, Warsaw.
Oh, cool.
Yeah, it was pretty interesting. Very Eastern Bloc kind of.
Yeah?
Yeah, and it was one of the newer ones in Europe apparently, and it was pretty old.
Oh, really?
Yeah. It looked like the control board was very, I want to say Austin Powers, but it was kind of exactly how you'd expect if you imagine a like control center in a nuclear reactor built in the 70s. It was like that.
Like in the Bond film.
Yeah.
Big levers you push up and down. And
yeah. And like blokes with white lab coats on with big moustaches. It was so funny.
I'll say the UK's coming up. We're getting some new nuclear power stations as well. If I saw that in the news,
there is a closed one in Bristol. The old Oldbury nuclear power station, but it's not operating at the moment.
This one was down for repairs, so we could see down into the core in the water.
Oh, okay.
So it was under 7 meters of water. Safety wasn't particularly that good, so there was no fence. I was just stood looking into this like crystal clear water that was super toxic. It's like beryllium.
Is that where they dispose of the nuclear material then, in those pools?
No, that's for cooling.
Oh, for cooling. Okay.
Yeah, and as a shield for the radiation, because it's so high radiation and water's a good shield.
Okay.
So it's the reactor core is under 7 meters of water.
Okay.
Yeah.
We were just looking at that before. It was are you familiar with the XKCD what if scenarios? No. Basically, they write into this guy and they'll ask questions. One of them is, could you go swimming in a nuclear cooling tank?
That's what we were asking when we were there.
What did they say to you?
They were like, we would not recommend it because they use beryllium for something in it, and they were like, beryllium is so toxic.
Okay.
That you'd probably die from the toxicity of the beryllium more than the radiation.
That probably would be quite dangerous then. Well, in this case, they were saying that you'd probably be fine swimming in most of the tank because water is such a good blocker that you'd have to get pretty much right up and almost be touching the rods for it to be dangerous.
Yeah.
But he still advised don't do it because you'll probably be shot by security.
Yeah.
If you manage to go swimming in a nuclear cooling tank, then well done, and also go to a doctor.
Yeah.
In fact, one of the really interesting things from that what if scenario is if you swim down and you get close to it, you get really close to it, you start getting a radioactive dose. But in between, you actually have less of a dose than if you're outside the pool. Because of the general background radiation in the air, the water blocks that. So when you're halfway between the rods and the surface, you've got less of a dose than when you're standing outside the pool, which is a bit crazy to think about.
This is what I wanted to talk about in a second, was relative doses and like how people perceive dose. Like you say, if you're undergoing a nuclear imaging, then yes, you're going to be getting a higher dose than if you're walking around. But there's natural background radiation.
Well, can I talk about something relative?
Go for it. Yeah.
People are often worried about living next to nuclear power plants. And I know this is a different scale to like putting nuclear stuff in you, but they often get worried about living near them because they're worried about radiation and leaks and stuff. And that might be true if there is a breach in the safety and security. The radiation equivalent of living within 50 miles of a nuclear power plant for a year, that's the same amount of dose that you would get from eating a banana. So don't worry about it too much.
Yeah. Bananas are pretty radioactive, aren't they?
They are, yeah, more so than other fruit. Yeah. But don't worry about eating them.
Yeah, still eat bananas, everyone. That's one thing I've got is the banana equivalent dose, which is a unit used to keep people informed about radiation. And the actual unit for radiation is the sievert.
Sievert.
Yeah. Millisievert, depending on what quantity you're going to be talking about. If you eat a banana, it represents 0.1 microsieverts, And so they say 100 bananas is the banana equivalent dose, because then you get 10 microsieverts.
Yeah.
100 bananas and you have 1% of your average daily tolerance to radiation. So in all, things are looking pretty safe. I've got a list of different categories here, and I was just wondering what you guys thought of what was more radioactive than other things. The radiation you would receive by flying from New York to LA versus the radiation from a dental x-ray.
I'm going to go with the flight, because I know that flight's high radiation.
Yeah, that would be a really boring stat as well if it's just like, yeah, no, the X-ray is exactly what you thought.
Yeah, it's exactly what you thought.
It is. The X-ray is more
radiation. I don't have a really good list of stats.
I apologise
here.
what I said about your fact.
No, so I just don't have a very good list here. But it's...
But I know pilots are at a greater risk because they're constantly flying and they've got less atmosphere, I guess, to block cosmic rays.
But I've got roughly 100 microsieverts for a dental X-ray, which is just a single image of just your mandible, so you're not imaging a large part of the body, and you get 40 microsieverts from a flight from LA to New York, so almost half of an X-ray. Transatlantic flights, I think you'd be talking about at least the same amount of radiation,
but probably not as much as a minor, because I think you get quite a lot of radiation just from I think the UK has a lot of radon sources. It just deposits in the ground where you can have, even if you live on the surface, you can be slightly more exposed to background radiation than other places. And then miners have to worry about it as well, long-term exposure.
Isn't Cornwall pretty radioactive?
I think it is, yeah.
Yeah, something to do with granite.
I don't know. I think
I don't know if it's the granite, but it's definitely living in Cornwall. You're more at risk from radiation.
Yeah, it depends on the rocks, the quartz, or the different materials that you're living on top of, if they're radiating a different amount.
Yeah.
I want to see that now on real estate websites. They have little, like, you know how they have chilies next to certain things on a menu, or bananas next to my house, to see how much radiation there is.
I have to carry the badge around, a dosimetry badge, with me.
What is that?
The dosimetry badge, so to measure how much radiation we're receiving.
Oh, right, okay.
And we have to send them off monthly to Birmingham Uni, I think, do it. And it just shows how much radiation you've been exposed to. It's just a legal requirement. So all staff in the hospitals will have them as well, but they also have finger ones as well. Right. So either ones that are rings, so there's a ring dosimetry, but the big one at the moment, quite a lot of the staff will have one sellotaped to the end of their finger.
But it's not immediate feedback, is it? They have to analyse it.
They have to analyse it. Yeah. But one of our staff in a month went over his year allowance.
Ooh.
And they were just like,
are you guys handing out free samples? How are you what are you touching?
So there's like, the company was just like, we need to call Jack immediately, call him in, he can't go to any more hospitals. So he'd like entered the red zone. Turns out he'd left his bag in a room while they were doing x-rays.
Oh no.
For like I don't know how long it was, but he was there for a good few hours and he just left his bag. And the dosimetry badge was just receiving.
Oh, so it wasn't him, it was just the badge.
No, it's just he didn't keep his badge with him, he'd left it in his bag. So he didn't actually, so they've let him go back out.
Okay. I thought you meant his bag had got irradiated and then somehow irradiated him or something.
No, it's just the badge.
So I've just got a map of the UK with radon hotspots, and I'll turn it around so you can see, but I'll describe it, obviously. Yeah, you're right. Cornwall is basically red. And
100 bananas right there.
Most of Wales and then the north of England is pretty high radon levels, with a little belt across the Midlands as well.
What about Bristol?
That's pretty orange.
Oh,
yeah. But I mean, I don't think it's something to worry about so much.
It's just the way they shade it. It's like red means that you're like, oh,
yeah,
that's really bad, but really it's probably like not bad at all.
Yeah, it's probably like 5 bananas or something.
So you're saying about radon, and I know that in the early days when they weren't quite sure about how dangerous nuclear material actually was, and radon was being used because it glows in the dark, and it was used to paint the flecks of the hands on people's watches. So when it's low levels of light, it's still used, and because it's safe, because it's only tiny dose. But how they used to apply the radon to the hands and to each of the numbers on the watch was by hand. They had to paint them on. And painters, what they do is they're trying to make a really fine point on their brush, they put the brush in their mouths.
Oh no!
Yeah.
So even if you wash it off, there's still traces of the radioactive isotope. And if that's what you're doing for your day job, there was a huge increase in mouth and oral cancers from watchmakers who were having to paint on radon onto watches, which is a sad fact.
Well, you were saying the early days when radiation wasn't understood as much. I think Marie Curie. Marie Curie. She was the first woman ever to win a Nobel Prize, and it was for her work on radioactive stuff.
First woman professor at Paris University as well.
Really? Okay. Her diary, I think, is still available in a museum, and it's highly radioactive for obvious reasons.
Well, she used to handle it, didn't she? She didn't let it, she was just handling like highly radioactive substances daily.
Well, she was one of the first people to understand it. So, I mean,
at the time, no one would know if it had any effect on her.
Exactly, yeah. It was probably a bittersweet moment when she found out. She went, "Oh wow, I've discovered." Oh no. And she thought back to eating all the radon.
Yeah, because she died of leukemia as well, didn't she?
I think so. Yeah. It was definitely related to
the reactor I was at was the Maria reactor that is named after her.
Oh really? Okay.
Yeah, because it's Poland, and that's where she was born.
Well, speaking of other security problems, have you heard of the Guyana? It's in Brazil. The Guyana incident in 1987.
No.
Okay, well, this was pretty bad for. We were talking about the image of radioactive substances and their use in medicine. This was 1 year after the Chernobyl incident, so people weren't. And again, middle of the Cold War or the end of the Cold War, people were not particularly trusting of it. So this didn't do much good for the image. But basically, there was a disused hospital which had radioactive material in it, and two men broke into it to steal scrap metal. So they took a 300 kilogram container. They then transported it away from the hospital to their house about half a kilometre away. I think it was fairly well protected because they had to work their way into it over the course of several days. But when they got into it, they found all this blue stuff, glowing blue stuff, which is why they were so interested in it. So they invite family and friends over to have a poke about, have a look at it. Everyone's talking about it in the village, and they're giving out bits as souvenirs. And you don't look happy because you know what it is. It exposed a lot of people to it. They were getting really ill at this point, like diarrhea and vomiting, obviously from high doses of radiation. One of the men's wife took it to the local hospital in a plastic bag. Eventually they had an expert come in and go, "Oh yeah, this is actually cesium-137, I think is what it is." It infected a lot of people. I think 4 people died as a direct result, and many other people had more negative health effects.
Yes, negative health effects from radiation exposure.
From cesium.
So, I mean, this was obviously, it was a disused hospital. It probably wasn't being protected as much as it can be. But when you do you store large amounts of it? How is it protected? Is it in these metal containers?
So yeah, just a lot of lead. So as a company, we don't actually store any. We're not allowed.
Oh, okay.
But it's transported. So when someone orders it, it's pretty much flown straight in and taken straight to the hospital. And there's a lot of protocols about delivering it. It has to be signed in and out for. But there's a lot of hospitals that need it disposed of. I don't think they use it so much as they used to. But because it's got such a long half-life, a lot of this cesium's just been sat in hospitals.
One of the guys that died from this incident was buried in a lead coffin. A lot of the locals came out to protest that he was being buried. She was being buried in the cemetery because they thought that their dead relatives were going to become radiated as well. I don't think they would have because she was in a lead coffin. But yeah, that was the worry about the long half-life. It was the corpses were still heavily radioactive.
It's really, really long half-life cesium. Recently, the US have stopped accepting it. So traditionally, it was always a lot of the radioactive isotopes, when they're kind of spent or used, after it's past its usable life, it's still radioactive and has to be accounted for. So a lot of them were flown back to the USA to be stored because they got a lot of space. But that's one of the big troubles with nuclear reactors, isn't it?
Disposal of it.
It's the disposal. You just have to store all the waste somewhere. There's a small amount of waste really when you think about the amount of power you're getting from it, but it's the storage of the waste that's the big problem, because no one wants nuclear waste stored by them.
It comes down to perception as well. I don't think people realise how radioactive the smoke that comes out of coal power plants is, because that obviously it comes out the chimneys.
Yeah,
it's fairly radioactive. I mean, it's not crazy. It's not like a lump of plutonium or something. Yeah. But it just comes out of chimneys and gets spread for miles and miles around.
Yeah.
Whereas if you bury some waste from a nuclear power plant, it's going to be there for a long time, but it's relatively small. And you can contain it.
I've got a few more stats here that hopefully interest you a little bit more.
Go on.
Okay, so we're on millisieverts, and we're talking your natural radiation exposed to in a year versus a CT scan of the head?
I should go first 'cause I have no idea. I'm going to say the background radiation is more for a year. That's quite a long time.
You said the year's more.
Yeah.
I'd go with that as well, I think, because it is only a CT scan of the head is a small scan.
Yeah, it's only a small scan.
So yeah, I'd go a year.
Well, in this case, they're equal.
Oh, really?
Yeah, natural radiation is about 2 millisieverts according to these stats, and the CT scan of the head is also 2 millisieverts. Okay, so full body CT scan is 10 millisieverts. How much for airline crew on an annual basis? Let's say they're doing transatlantic or
annual
trans-Pacific flights. It's not as bad as you think.
I reckon you get about double the radiation if you fly that much in a year.
20 millisieverts.
Yeah.
I'm going to go 15 millisieverts.
Okay, 15 is closer. It's actually 1 millisievert less. It's only 9
I think it's a bang on. Yeah.
So there has been a lot of hype around about how airline travel has exposes you to a lot of it's cosmic radiation more than anything because you're that little bit higher up in the atmosphere.
Yeah, less protection
quite a lot
from
higher
up
in the atmosphere.
Yeah.
So you get exposed to more cosmic radiation, but it's even on an annual basis, it's not too bad. At the same time, if you're getting a full body CT scan every year from however long you're employed, that's still an increase. But you need an increase of about 100 millisieverts a year to be at risk of cancer.
So us in the UK, we're pretty tight on CT scans, and they'll try their best not to scan young people.
Yeah.
Whereas there's a big argument at the moment. The USA, because they CT scan pretty much everything, they'll just
just throw it in. Yeah,
I think the paper was titled like the silent killer, that they predict that in the future, because of the overuse of CT, they're exposing people to such a high risk of cancer, especially in young women, because of the obvious risk of breast cancer. But over here, we're really tight on it. But it does vary country to country.
I can see that sort of being the antibiotic scandal of the future.
Yeah,
like when we're running out of antibiotics now, and then in the future, like, we can't scan people anymore. We've caused cancer on everyone.
Yeah.
So there are. That's it. I don't know enough about it, but I know there's other medical imaging techniques, like you say, the MRI scanners, which don't require any nuclear, and I suppose different to an X-ray or, like you say, an anatomical scan, which doesn't. It relies on radiation in the case of an X-ray, because it's radiation that passes through you. But again, relatively safe because both X-ray and gamma radiation is very weak ionizing compared to alpha or beta.
Yeah. Well, we were talking about swallowing alpha. That's what you don't want to do because the polonium sample, which is what killed. That was what the Russian spy in London was killed with. What's his name? Litvinenko.
Litvinenko, yeah. In his tea.
That was a real
polonium.
Yeah, polonium 210. I think.
Yeah.
I think that was the little poetic bit. They were like attacking our tea as well as our defected spies as well.
Okay. Slightly new topic. Do you do anything in nuclear therapy, or is it strictly nuclear imaging?
So the company. So I do most of my stuff's diagnostic, so imaging. But the company, we do therapies, quite a few therapies. There's a big one that we do called Lutathera. So that's again neuroendocrine tumours, which are tumours that arise in the endocrine system or nervous system. So that's intestine, pancreas, along the spine, that kind of thing.
Okay.
So that's
important bits.
Yeah. So the therapies, there's also I think lutetium is they use it theranostically, so therapeutically and diagnostically.
Okay. Who came up with that? Mashing the words together.
I don't know. It's pretty good. It's a big thing now, theranostics.
Yeah?
Yeah.
I'll have to keep an eye out for it.
Cost effective, I imagine.
Yeah. But it also so you can like image while treating, and then so you'll be able to track the treatment. If it's a gamma emitter and an alpha emitter, you can obviously image it on a gamma camera whilst it's treating, so you can almost live track a patient's treatment.
Yeah.
So there's a lot of research going into dual emitters.
That's pretty good. I know I've only got a little background on how nuclear therapy works. So I wasn't really aware of different sources being used, like alpha source. I never heard of that. I knew about radiotherapy. I thought that was normally done with gamma as a source, but my basic understanding is there's these proteins called antibodies, and they have a nuclear element attached to it. The antibody then is injected or ingested into the body, and that antibody, that protein, can then bind directly to the cancer.
Yeah.
And then so the radioactive source is literally connected to the cancer cell, so that the radiation mainly penetrates and kills the cancer cells rather than your healthy tissue.
Yeah. So that is one way of doing it. Yeah. You can do that. There's quite a few other ways. So there's the one I mentioned earlier, the Theraspheres.
Yeah.
So that's not specifically targeted in that it binds with the cancer. It's just if you inject it into the hepatic tissue, it effectively gets stuck and just emits radiation to the area and just hope that it kills all the cancer. It's more.
You'd have to target where you inject it.
Yeah,
or you'd
you
have to
inject
get
it into the hepatic artery.
Okay.
Yeah. And then there's this new product. So there's 4 worldwide. Quite exciting, really. So it is a MRI guided radiotherapy. It uses an MRI scanner and a cobalt source. So the MRI reads where the tumor is, and then obviously you target the radiation to that point, it radiate the cancer tissue. But what's good about this one is, so it's live. Previously, some radiotherapies, you get a gamma source and pretty much just point it at the area and hope that it's killing the cancer tissue. Your body doesn't just stay still, it's moving around a lot. Because it's live MRI, as your body moves, it kind of reads what your body's doing, and then as it enters the area where the source is targeted, it like beams it and then stops when it moves out. So it will only kill cancer tissue.
Oh, right. Like heat-seeking missiles.
Yeah.
Yeah, effectively. Yeah.
A lot of the things you've been talking about, they sound like if they came up on a Star Trek episode, I'd be like, what a load of nonsense.
The one thing that always baffles me with medicine is that's a brilliant treatment, and it costs like £6 million, and it'd be amazing to treat cancers with it. But it's so expensive. You're not really going to be able to use it on people.
Yeah.
You will be able to.
There's an opportunity cost associated with it.
Yeah, to start with, they're only using it on like tiny amounts of brain tumor patients because it has to be so targeted.
Yeah.
You're not really just going to like be like, yeah, that kind of suits. Let's just shoot a load of radiation at it because you'll kill brain tissue. So it'll start with that. But whether it takes off, like ideally it'd be like a CT scanner. Like every hospital has 1 or 2 of them.
Yeah, I imagine if you can get a technology cheap enough, then it becomes more publicly available.
Yeah.
So if more and more hospitals had it, then you could, even large cancers, you could target effectively the whole cancer.
Yeah. But you say that MRI and CT scanners are a few million quid each.
Yeah.
Yeah. So what's the view rate? 10 million the view rate is, and there's 4 worldwide. Trying to get one in the UK at the moment.
If it's ridiculously expensive, every dollar spent on that is a dollar not spent on something else potentially curable. So it's got to be.
Yeah.
It's got to come down in price.
If you can treat 10 people quite effectively, as opposed to 1 person really effectively, it's where would you put the money?
To be fair, if you're dying of cancer and someone goes, yeah, it's going to be £1,000, you don't go, well, no, I think I'll pass.
That's the trouble with a lot of treatments. There's one that's a life extender, is that the right word? So you're still going to die, but you get to live a longer life.
Okay.
And you need 4 doses of it, and it's £16,000 per dose. Ooh. But that's not even an expensive one. There's some breast cancer ones. They're like £27,000 per dose.
How do you ethically spend that?
Well, especially when you've got diseases that you can, lethal diseases that you can treat for a few dollars with a vaccine, and you've got to compare them like that.
It's difficult.
Of course, that individual, if they can afford it, there's no limit to what they'd be willing to afford.
Yeah.
Which I guess in economics they call that inelastic demand, and it's the basis of Breaking Bad. So.
Well, we like to ask if for 30 seconds, have you got anything that you would like to rant about?
I've got something that does annoy me about my job title.
Okay, what is your job title officially?
So when I joined the company, my job title was sales rep.
Yeah.
And then it's been changed to graduate account manager in clinical nuclear medicine.
Okay, a bit longer.
And it's just something that winds me up a bit about sales reps and how they know they're sales reps. The titles get changed to account manager because it sounds better when everyone knows you're a sales rep. And you have to introduce yourself, I'm an account manager. And it's like, I'm just a sales rep.
Yeah.
Like everyone knows
I've got some products.
Yes.
They're good products.
Yeah.
You have to choose.
And also when people come in, no, when you go and visit people and they're like a bit shocked that you're trying to sell them something, it's like, you know I'm a sales rep.
Yeah.
Don't get shocked when I ask you to buy something or whether you're interested in buying. I didn't come here for a chat. Like, I'm essentially here to sell you something.
Yeah.
So don't act all coy.
Okay. Well, thank you very much, Will, for coming on the show.
Thank you for having me.
I think that's all we've got time for. I've been Jacob Mitchell.
I've been Jack Townsend.
And I've been Will Bryan.
And in many ways, we still are. Thank you for listening.